Heart attacks and strokes are the country's two biggest killers. Well, now the Heart Foundation has joined with the National Stroke Foundation to do something about it. They've come up with the Heart and Stroke Charter comprising a 5-point action plan, and top of the list is prevention of heart attack and stroke. Then early detection to identify people at risk, faster treatment to save lives, and improvements in the quality of care. And finally, rehabilitation to help survivors avoid repeat events. Well, with more details, here's Mary Barry, the National CEO of the Heart Foundation. So, Mary Barry, which of those 5 points is the most important in your view?
Well, you could break the 5 points into 2 points. One is prevention and one is aftercare. What we're wanting to do is to reduce the risk of heart attack and stroke in Australia, and also to reduce the cost of healthcare that follows that. In Australia, heart attack and stroke are the two biggest killers of Australian men and women, and it's also the most costly in the health burden. It costs $7.6 billion a year, or 12% of the budget. So we're encouraging governments to implement a prevention program that involves identifying those at risk very early in the piece through what we're calling an absolute risk assessment. There are two sides to it. There's the clinical side, which looks at their blood pressure, their cholesterol, their risk of diabetes, and then we have the other side, which is done by the GP, which looks at family history and lifestyle. Combining those two factors, people can look at what level of risk they have of having a heart attack or stroke over the next 10 years, and they can take action to prevent having a heart attack or stroke.
And it's the same set of health circumstances which cause both heart attacks and strokes, is that right?
Yes, the same risks are accountable for both. And also there are people who look like they're fit and healthy, and they may feel fit and healthy, they may eat the right foods, they may go to the gym regularly, but there are people out there who have high blood pressure and high cholesterol and are totally unaware of it, and there are no symptoms. So it's very important that everybody over 45 years of age has what we're calling an absolute risk assessment, even if they are fit and healthy, because they can have treatments early to prevent heart attack or stroke. And you often do hear of people who are fit and healthy having a stroke or a heart attack, and everybody is surprised.
Yeah. Is it the case, Mary Barry, that many people are unaware of the symptoms of a heart attack, firstly, apart from chest pain? They don't know that they're having a heart attack, or indeed have had one?
That's correct. We also want a community awareness campaign around the warning signs of a heart attack. And basically a heart attack would involve jaw pain, neck pain, shoulder pain, sometimes may not even involve chest pain, which people generally associate with a heart attack. When those symptoms do appear, we encourage people to phone 000 immediately. And if they're not having a heart attack, all the better. But if they are, it's very important to get to the hospital as quickly as you can and commence treatment.
And if you are at risk of heart attack or stroke, is it a case of going on medication, or are there just fairly simple lifestyle changes that can be made?
It depends on your level of risk. If you've got high blood pressure and high cholesterol, or very high levels of either, then your GP may recommend medication. If it's because you're obese, or perhaps because your diet is unhealthy, or you're physically inactive, some lifestyle changes may reduce your risk also. So it's really very important to get the absolute risk assessment done, so your clinical factors plus your lifestyle factors can be looked at together, and you can actually get the most appropriate advice and treatment.
Mary Barry, thank you.
Thank you.